Hey guys, what's going on? So, this is the Coronavirus Task Force meeting from yesterday. The president gets up to speak for about 10 minutes or so, and then he addresses the point of demographic disparity. It seems like a lot more folks in the black community in places like Louisiana and even here in New York, a lot of more minority groups seem to be getting hit by this thing. So, let's take a look at what the president has to say. Mr. President,
Thank you very much.
you're welcome.
Today we continue to send our love to the great people of New York and New Jersey. We support them fully. We grieve alongside every family who has lost a precious loved one. New Yorkers are tough and strong and brave. New Jerseyites are tough and strong and brave, and they're being hit very hard right now. And for the next week, hopefully not much longer than that, it's going to start to go in the other direction.
No.
Our country is being hit hard, but some areas have done so incredibly well. We're so proud of them. They will beat this virus. We're going to beat it with the grit and the heart for which they're known and for which our country is known. And we appreciate everything that everybody is doing. We pray for Prime Minister Boris Johnson. He's become a great friend of ours. He loves this country.
He was admitted into intensive care the other day, Prime Minister of the United Kingdom.
Very good to us. Whenever we had difficulty, he was with us, and we appreciate it. So we pray for Prime Minister Boris Johnson. He's going through a lot. As we intensify our military campaign against the virus, I think that it must be brought out that we have to thank the American people for continuing to follow our guidelines on slowing the spread, an expression that more and more people are thinking about. Nobody ever heard of it 2 months ago, and now everybody is talking about slowing the spread, stopping the spread.
We think
Even
people
during this painful week, we see glimmers of very, very strong hope, and this will be a very painful week.
Some areas have had
next week,
lower
at least part of next week, but
deaths
probably
day over day, but
all of it. Look, if one person
can't
dies,
tell.
it's a painful week. And we know that's going to unfortunately happen. This is a monster we're fighting. But signs are that our strategy is totally working. Every American has a role to play in winning this war. And we're going to be winning it. And we're going to be winning it powerfully. And we'll be prepared for the next one should it happen, but hopefully it won't. Our massive airlift operation for critical supplies, it's called Project Airbridge, continued today as 5 massive flights landed in the United States packed with personal protective equipment, and our nation's heroic healthcare workers.
We had Bob Kraft and the Patriots for that here in
27
Massachusetts.
more flights are scheduled in the near
Part of
future
it.
over the next
A lot of
couple
folks are helping.
weeks. The Army Corps of Engineers is constructing facilities that will support more than 15,000 hospital beds to treat patients in need. So they're building now approximately 15,000. They just completed the big one in New York. They just completed and are in the process of continuing in Chicago and many other places. They're incredible. The Army Corps of Engineers, we owe them a lot. What they were able to do in such a
They are
short period of time.
phenomenal.
They build these massive facilities, 2,000 beds in 4 days. So it's really something very special. I know I was in the construction industry, and you don't see that happen very often. I want to remind governors and emergency managers that sharing real-time data with us about equipment and their needs is very important.
We keep track of
All
everything,
their supplies,
so we know where all the resources are dispersed.
A lot of the
If folks start to see
occupancy
tapering
is,
off, if they feel like they're in a good space,
really
we need to
getting a
shift
little
those
bit
to
lower
areas
than
that need it.
anticipated, and that's good. We sort of thought that was going to happen, and we're getting along very well with the governors. This whole situation with respect to talking to us about equipment and equipment needs, giving us a little bit of lead time, so important. All the supplies, we're getting it to everybody like they never thought possible, but we'll ensure that we can rapidly deploy federal assets where and when they're needed, especially on ventilators. We're actually getting some ventilators back. As you know, the state of California was great. They sent some back, which they won't need. and Washington State likewise.
California was a major
And
concern.
we have some others coming back, so we're using them in areas we need them. We are pressing forward aggressively on the scientific frontier of the medical war. The companies I've spoke to, the four leading, I call them the genius companies. They're doing incredibly well with respect to cures and also with respect to a vaccine that's going to protect us, totally protect us. And they have some great potential. It's going to take a little while yet, but they have some great potential, some great early results. And the governor's been working hard, and we are working hard with the governors. There's been great coordination, especially over the last little while. We're giving them a lot of equipment, a lot of ventilators, but a lot of equipment of all types. And I will protect you if your governor fails. If you have a governor that's failing, we're going to protect you. But the governors are working well with us over the last period of time. Today, in our stockpile of ventilators, and again, we need the stockpile so we can immediately move them from place to place wherever the monster hits. It's a monster. We have 8,675 ventilators right now in stock, ready to move. And we have all sorts of incredible soldiers. Our military is going to move them should they be needed. In, as an example, if we need additional in
Army
New
Corps
York,
engineers don't mess
in
around.
the New York City area, you have state, you have city, and spoke to Mayor de Blasio, and we really have a great, well-coordinated campaign with Mayor de Blasio. It's been really good.
God bless
Spoke
New
to
York
Governor
City.
Cuomo. It's been great coordination. So if they need something, we have it. If Louisiana needs something, we have it. Same thing with Michigan, same thing with Illinois. There are certain spots that are very hot. And we'll see what happens, but we'll know pretty much. We'll have time, and we'll be able to move it. In addition to the 8,675 ventilators, we have 2,200 arriving on April 13th. We have 5,500 arriving on May 4th. These are ones that we're building for the most part.
So the president's giving the logistics
have,
of
as you know,
ventilator
companies building
production
them.
schedules.
Ford, General Motors, GE. We have really some great companies that are doing it. On May 18th, we have 12,000. On June 1st, we have 20,000. On June 29th, we have 60,000 ventilators coming. 60.
Is that total
So we
or?
have a total of 110,000 ventilators coming over a short period of time.
Good.
I don't think we'll need them. Hopefully we won't need them.
Better to have and not need it than need and not have it.
We'll have
But
them
other
for the
places will need
future.
them
We'll
too.
also be able to help other countries
Right.
who are desperate for ventilators. The UK called today and they wanted to know would it be possible to get 200, and we're going to work it out. We got to work it out. They've been great partners, United Kingdom, and we're going to work it out for them. So they wanted 200. They needed them desperately. We now have 10 drugs in active trials, with 15 more soon to follow, as well as 2 vaccine candidates in active clinical trials. We'll do whatever it takes to secure needed medical supplies and bring more production of essential medicines back to our shores. We're doing that. We're bringing them back to our shores. A lot of these companies, they went a little bit haywire. They went away from this great country and they had them produced elsewhere. So we're going to start bringing them back. I've been talking about that for a long time, not only with medical, but lots of other things. America continues to perform more tests than any other nation in the world, and I think that's probably why we have more cases. Because when you look at some of these very large countries, I know for a fact that they have far more cases than we do. But
Testing schedules and stuff. If a lot of folks don't have symptoms, you don't know.
1.87 million tests today, so that's 1,870,000
That is a lot of tests.
million tests. Think of that, 1,870,000 tests.
It's like half our population.
And now we're performing them at a level that nobody.
Oh, half of a percent of our population.
As
Math
we
is
announced
hard.
yesterday, CVS testing sites in Georgia and Rhode Island will be using Abbott Labs rapid 5-minute tests. We're down to now 5 minutes. It's a 5-minute test.
So
that
we are
people
starting to
can get the
deploy some of
results
those
back very quickly.
those faster
And we're
machines.
actively
We had one set up
engaging on the
locally
problem
around
of
where I am in
increasing impacts.
Massachusetts.
This is a real
Partnership with
problem.
CVS.
and it's showing up very strongly in our data
I believe
on
it's
the
a rapid
African
lab.
American community. And we're doing everything in our power to address this challenge. It's a tremendous challenge. It's terrible. And provide support to African American citizens of this country who are going through a lot, but it's been disproportional. They're getting hit very, very hard. In fact, while we have Tony here, I'd like to maybe have you come up and address that one, and then I'll continue. But if you could address that, it would be great, Tony.
Dr. Anthony Fauci.
Yeah, thank you, Mr. President. We have a particularly difficult problem of an exacerbation of a health disparity. We've known literally forever that diseases like diabetes, hypertension, obesity, and asthma are disproportionately afflicting the minority populations, particularly the African Americans. Unfortunately, when you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad. It's nothing we can do about it right now except to try and give them the best possible care to avoid those complications. Thank you, Mr. President.
Thank you very much.
All right. And we'll stop it right there, not to go too long. But as you heard, and this is something that was addressed the other day by the governor of Louisiana. My apologies, I forget your name, sir. But it appeared that I believe it was right around 70% of those that ended up succumbing to COVID-19 or COVID-19 related symptoms having it were of the black community. You are seeing similar, maybe not the exact same, other things happening in different parts of New York as well. This is a tough time. This is a test for all of humanity. Yeah, that's what we got right now. There are a number of centers going out. Again, according to the CDC, if you have the ability to basically use some sort of face covering, cover your mouth and your nose there seems to be some confusion about that. Because here's the thing. Might it slightly less likely to get something? Let's face it, we've all maybe held our breath at some point or another, or try to cover our face during whatever may be going on. So if that's a natural thing, but at the same time, if you're less likely to spread something, if most folks are out there less likely to spread something, the chances are going down. There's always a chance, but we're setting ourselves up to maximize our statistical chances. Again, math is hard, but it also kind of makes sense. So, but hey, thank you all for watching. Peace out, everybody, and long live the elbow bump.